Now, ladies and gentlemen, it's a privilege to introduce our first speaker of the day, Dr. Santhosh K. Raghavan. Dr. Raghavan is a distinguished academician, expert administrator, researcher, and the professor and head of the Department of Physical Medicine and Rehabilitation at Government Medical Trivandrum. He is also the chairman of the scientific committee for this conference. He previously served as the head of the department and medical superintendent at T.D. Medical College, Alapura. His contributions to the field are widely recognized, and he has been honored with the P.T. Chaco Award for Administrative Excellence. Today, he will be enlightening us on the topic of approach to pain. Please join me in welcoming Dr. Santhosh K. Raghavan to the dais.
Really a pleasure to be with you here. I must thank the Trivandrum Physiatry Club, the GET SET organizers, for inviting me to this audience to really sit on the chair. Everything is being announced. So very good. So Dr. Santhosh, please start.
Respected chairpersons, dear colleagues, my dear students, let us start our CAB program. The topic allotted for me to present is management approaches in pain. As we all know, pain is a common malady that is actually bothering the generations of Homo sapiens from time immemorial. And even now, pain is considered as one of the most common causes for presentation in the emergency department. Let me start the presentation with the two phases of Homo sapiens who have reached at two phases of their life. Two varying phases. The first one is a newborn, and second is a person who has reached the advanced phase of his life. The newborn, crying of a newborn means it is the only language that the newborn knows. And first cry of the newborn is actually an occasion for jubilation for the mother and also kith and kin. Whereas the second person who has reached the much advanced phase of his life, that cry that might have produced by a dental caries or by a metastasis in the trigeminal nerve or trigeminal neuralgia is actually an occasion of agony for the kith and kin of the person. So the pain is the diagnosis in both cases. In the first case, it may not be pain or it may be pain, but in both cases the approaches are different. So from the picture itself, it's very well known that the approaches to pain are different, and hence this topic. And these are the objectives for my presentation. Define pain. Is the pain is a boon or a bane? Then different approaches for pain management and the management concepts among the selected groups, and finally concluding remarks. So as per the definition given by the International Association for Study of Pain, IASP 2018, an unpleasant sensory and emotional experience that associated with or resembling that associated with actual or potential tissue damage. So however complicated the definition, the crux part of the definitions are, it is actually an unpleasant sensory or emotional experience that associated with the tissue damage. That's all. And is it a boon or a bane? Coming to, you look at the diagram, the diabetic foot ulcer, which is actually an end result of loss of protective sensation. Here the pain is acting as a protective sensation, and it is definitely a boon for the patient. And once it is lost, that lead on to the complication of foot ulcer. And look at this case, the phantom pain. Even after the chopping of the limb, still in 4 to 80% of cases of amputation, you can have this problem called phantom pain. Even after loss of the limb, the person is actually ailing with the pain. So this is actually acting as a bane for the person. And coming to the different approaches, 6 approaches I am going to elaborate. The self-management, pain medicine model, integrated approach, rehab therapies and chiropractic approaches, complementary alternative approach, and finally comprehensive approach. Self-management, self-strategies that are used by the patient. Just after onset of the symptoms of pain, the person is thinking about why can't I manage this by myself. So one of the most common methods, and here this is the method in which the most active participation by the patient is invested, because it becomes the sole responsibility of the patient, and treatment of the whole person he considers, he or she considers, and in which the empowerment of the patient or empowerment of himself or herself is the idea as per the NIH 2013. what are the methods they adopt? Talking to friends, searching for the internet, attending groups, classes or programs. They may exercise, they may apply ice or they may apply heat as the case demand. And they will position the limb in the position that gives them maximum comfort, and they limit their activity. Then OTCs, over-the-counter medicines, and actually pain is one of the most common conditions where over-the-counter medicines are maximally sought. And finally, they may go for attending the education classes. Many cases it is useful, but not always. So that is in red is very important. In many cases it is useful, but not always, and always it is actually dangerous. Then coming to the pain medicine model, Institute of Medicine 2011 has proposed this model, self-management followed by, if it fails, goes to the primary care physician and finally specialty care. Actually the self-management is lesser important in this model. We focuses on the primary care physician. This is the model having the strongest business model because it is supported by the industries. And it depends on the professional training in the healthcare also, because professional training is also given in the same way. Pain first to be managed by the GPs or the internist, and then the management fails goes to the specialty. And here the maximum number of frequency of review, because to ensure the efficiency as well as to detect the side effects of management. But it is weak in efficacy, particularly for the chronic pain, and also leads to patient participation. So pain medicine model having the least participation and the self-care management having the maximum patient participation. Primary care provider is the mainstay, ideally coordinated by a general practitioner or by an internist. Initial assessment for the diagnosis are involving diagnostic blood investigations, then the imaging, and the prescription medicines got a major role in the pain medicine model. And finally, if they fails, they will refer it to the other specialist. And where that involves advanced imaging, and as we know, the surgical care are there, then interventional pain management, placing medicines in the area of involvement under the ultrasonic guidance or under the image intensifier, or finally RF ablation of the targeted nerves. These are all involving the specialty care. So this model is called the pain medicine model. Coming to the integrated approach, the self-management of pain or pain medicine model, the patient-centered care, the physical, emotional, and mental, social, spiritual, and environmental, all these factors are addressed here. And it's an integrative pain, integrative medicine, and the whole system approach for the integrated approach. And the integrated approach is ideally for the chronic pain management. Okay. And coming to rehab therapies and chiropractic. Rehab therapies, we address or we consider the physical therapy, occupational therapy, then the acupuncture, then the manual medicine, the chiropractic technique. And the aims of this management is pain relief and optimization of function. So here the therapists are mainly trained for management of the orthopedic conditions. Complementary and alternative approach. See, more than 30% of the adults and about 12% of the children actually use the healthcare approaches which are developed outside the mainstream Western. So anything which is coming outside the mainstream Western are considered as complementary alternative. When it is used in addition to the conventional medicine, it is called complementary. Using in the place of conventional medicine, it is called alternative. And a true alternative medicine is uncommon as per the National Center for Complementary and Integrative Health 2017. And coming to comprehensive approach comprises the use of all the 5 approaches that is described, and it is ideal for chronic pain management. Why these 3 populations are considered? Pain among dying patients, pain among the older patients, and pain among children and adolescents. Because these 3 groups were having the maximum incidence for underdiagnosis and even under treatment. Okay, and in some cases even over treatment. Pain among the dying patients, as we all know, advanced cancer, 64% of people may have severe pain, and it can be as high as 80 to 90% of cases at the end of pain. But don't think that always the cancer pain is the principal cause. Musculoskeletal pain forms the second most important cause for pain among the dying patients. And under treatment of pain is very common, and hence, because most of the people may be, some of the people at least, may be in comatose or obtended state, they may not be in a good shape to describe the symptoms and all. That is why we should sought the help of AI, artificial intelligence, for accurate diagnosis of the. So artificial intelligence, by analyzing the pulse rate, respiratory rate, facial pacing and all, we can have a correct diagnosis. Pain among the older adults. Incidence of pain is increasing after 60 years of age, and it is considered as the number one complaint among people over the 60 years of age is pain. And 1 out of 5 is on regular analgesics. 1 out of 5 a person above 60 years of age may be on regular analgesics as per the studies by Lilly et al. And they got a high pain threshold, but they got a low pain tolerance. That is, once they start complaining about pain, it will be having a very, very severe type they are going to describe. Accurate assessment is important among these people, and we should focus more on the loss of function, in what way that is affecting their functions in the performance of the basic activities of daily living, instrumental activities of daily living, in what way that is affecting their work and all. That we give more importance. Consider changes in their body and declining hepatic renal function, comorbidities, all these things should be considered when you prescribe the medicines for this group of people. And oral route is preferred over invasive one. And the incidence of polypharmacy, adverse reactions, and hospitalization as a result of adverse reactions are more common among these people. And remember about affordability also. You have to think about affordable medicines, otherwise what will happen? The skipping of doses or increasing intervals between the doses administration will be the result. And much more care if the opioids are used. For that, you have to closely associate with the family. The family should report regarding the true occurrence and recurrence of pain, so that you can monitor the medicines, because opioids, in view of that, the side effects, the respiratory depression, and the chances of, studies have shown that the chances of development of the addictions are very uncommon among this group of people. And for the drug prescription, follow the master rule. What is master rule? Master rule is actually an acronym. Minimize the dose. When you prescribe a medicine, you should minimize the dose. Start with a very minimal dose. And you should always opt for the safe alternative for any condition. That is A, and it is very slow to step up. When the response is getting, you are supposed to only increase the dose in a very slow pattern. And once you achieve the result, you titrate the dose. Reduce it, then you educate the person. For every a pill I need, that concept should be changed. And you should educate them. And if you are not getting a reasonable result in the period of time that you think, you revise the diagnosis. And active family participation is mandatory. And finally, the pain among the children and adolescents. 50 to 30% experiences chronic pain among these people. And the girls suffer more than boys. Migraine, pain abdomen, and MSK pains. These are considered as the most common causes, 3 most common causes. And for an infant, developmental stage of the infant is so crucial, because once if you are not treating the pain sufficiently in this infancy, their development itself can be affected. Often underestimated and undertreated, as I already described. Long-term changes in terms of pain perception and related behaviors can occur, as per the Santhosh et al. 2010. So you should prevent the emergence of chronic pain among these people, and pain behavior should be prevented. Such things can happen if you do not correct or control the pain in the right time. And accurate assessment is an issue. And again, for the infants, the role of AI is great, artificial intelligence. And titration of the correct dose is crucial, especially when you use opioids in neonatal practice. There is a problem called NOWS, that is neonatal opioid withdrawal syndrome. That is a reality that happened in US, detected in US, where the neonatology practice, they use then the opioids among the neonates for the very trivial symptoms. And finally, once you stop that, some of the infants tends to show this feature called NOWS. And once you when you treat these children with pain, always you should consider the number of days they lost for education, and for the parent, number of days they are losing from the job. And coming to my conclusions, pain is a highly subjective entity. As I showed in the first introductory slide itself, 2 approaches are there, and hence from subject to subject it is changing, and also the training of the person and also his expertise, the years of experience, these are all deciding factors of pain management. And assessment should focus on the function. Loss of function is a pertinent issue, and restoration of the function should be our objective. Restoration of function means restoration of function in every aspect of life. Basic activities, the instrumental activities, and their job function. Ultimate goal is improvement of the quality of life. Pain is actually a God's greatest gift to mankind, according to B.R.A.C.M.E. Because of the protective sensation that it offers, it is the greatest gift to mankind. Pain is inevitable, but suffering is optional. Pain is inevitable. As you grow old, pain may be considered as a part of aging. It is actually the price of aging. But the suffering should be made optional, and it's our doctor, as doctors, it is our responsibility to make it an optional suffering. These are my references. Thank you.